Okay, hello everyone. Welcome to Being Patient Brain Talks. I'm Deborah, founder of Being Patient. As many of you know, I'm really passionate about brain health, and any explanation as to what and how we can make our brains healthier is a subject that I like to delve into. So we thought we would bring back Dr. Andrei Irimia, who is at USC. He was just recently on Being Patient when we were talking about assessing brain age. Now today, he has the results of a pretty exciting study, which involves residents of the Bolivian Amazon. And the point of the research was to understand why these people have lower rates of Alzheimer's, what types of lifestyle interactions. Am I right about saying that?
Yes, thank you, Deborah, and thank you for having me here again. This is indeed a very exciting study that we've been working on for quite a while. We studied two indigenous populations in South America in the Bolivian Amazon. These are the Tsimané, which is a non-industrial population, and the Mosetén, which is a population that is also non-industrial but has more exposure to industrialization. So it's somewhere in between the Tsimané, who are completely non-industrial, and the industrial societies in Western Europe and North America and throughout the world.
Okay, so I am curious, when I was reading this study, I thought, how did you know, what was the link to Alzheimer's prevention and these particular communities? I mean, was there something apparent that made you say we need to study them in the context of brain health? How did we even know that they have lower rates of Alzheimer's?
So we did not know this originally. So this is a study that's been ongoing for the past 20 years. I've been involved in it for about 8 years, and my portion of it involves the analysis of brain images and brain health parameters. And originally, this was started by some of my collaborators, Hilly Kaplan at Chapman University, Mike Gervin at UC Santa Barbara, and others in our team. And the original purpose was to understand the effects of industrialization on societies and on brain health and on human health by looking at societies that live a non-industrial lifestyle, like the Tsimané. And the Tsimané are a group of about 18,000 people who live in the Bolivian Amazon basin, and they have a non-industrial lifestyle. They do not have electricity. There is minimal interaction with the industrialized world. And so we suspected that it would be very interesting to look at their brain health, because that might give us some insights on how the effects of industrializations on human health have affected us in the past 250 years since the advent of large-scale industrialization and food processing.
So yes, that was my next question. So presumably what you're looking at is diet, pollution, things like that we have a lot more exposure to in the industrialized world.
Right. And so the Tsimané live in an area that does not have much in the way of air pollution, although there is presumably some pollution due to fires that they use for cooking. There's also, however, very little exposure to processed foods because they eat off the land. They do practice agriculture, but they also hunt in the forest, and they have a lot of very high levels of physical activity, such that their lifestyle is quite different from the sedentary lifestyle here in the United States or elsewhere in the world.
So specifically, what are they eating? Is it a meat diet, plant-based diet? What are they eating?
So they have a diet that's very high in fruits and vegetables and high in fiber. And the meats that they eat are usually fish and lean game meat that they hunt from animals that they hunt in the forest.
Okay, so what did you see? Like what, in terms of defining brain health and concluding, perhaps why there's less Alzheimer's? You said you were responsible for the scanning imaging part of this study. What did their brains look like compared to other people's in the industrialized world? Maybe with, I mean, I can't say a similar population, but maybe similar age comparison.
So compared to other individuals of the same age and sex in the United States, for example, the brains of the Tsimané look much, much younger. And in fact, we had a previous study that reported on this and found that their rates of brain atrophy, so their rates of brain shrinking, are considerably slower than seen in the United States and Europe. And so it's very interesting because, as you know, as from our last podcast, brain aging is a risk factor, or it reflects risk for Alzheimer's disease. So then we asked ourselves, what is the risk of the Tsimané to dementia? And we had a study earlier this year in Alzheimer's and dementia where we reported that the Tsimané have one of the lowest risk rates for dementia. And in fact, their dementia is not usually of the Alzheimer's type. It seems to be a novel type of dementia syndrome that is new to science. And so we reported that earlier this year. And then in the paper we just published, we looked at investigating brain health in the larger context of health parameters and especially metabolism and food intake relative to what the ideal level of food intake and exercise might be for brain health.
So when you say atrophy, Dr. Irimia, so which parts of the brain are you talking about? Is it just normal aging where you see brain shrinkage altogether to indicate age? What are you measuring visually on, in terms of the size of which parts of the brain to tell you that this is a healthier brain than someone else, maybe, a like person who's lived in a very polluted city?
Sure. What we see is a global effect. So we see all regions, or almost all regions of the brain looking a lot younger. And what I mean by a lot younger is that we don't see the hallmarks of atrophy to the same extent that we do in, say, the United States. So what are these hallmarks? One of them is a ventricular enlargement. So in the brain, we have these large cisternae that contain cerebrospinal fluid. And in youth, they're relatively small. With age, they enlarge because the brain is shrinking. And so in the Tsimané, we see much smaller ventricles, cerebral ventricles, than we do in persons of the same age and sex in the United States. And so we implemented some novel image analysis algorithms to calculate brain volumes and to separate the brain volume into gray matter and white matter, which are the two components of the brain tissue. And then we calculated regional and total atrophy rates relative to, and compared this to the rates seen in cohorts from the United States and Europe. And then we found that at the global level, we have a relatively much slower rate in the loss of brain tissue in the Tsimané relative to the United States and Europe.
So do you know if there's any Alzheimer's at all in the Tsimané people?
So there are very few cases of dementia. A few of them have an Alzheimer's-like pattern of cognitive impairment. A majority of them, however, seem to be somewhat different in their presentation. But however, there are so few cases. This is incredible. In a population of 17,000, there are very, very few cases of dementia. And so it's difficult to anticipate what the implications are from the standpoint of nosology for Alzheimer's, because there are so few cases. And so we have one of the groups of people with the lowest incidences of dementia in the world.
It's fascinating. Do you know if any of them had the hallmarks like plaque in their brains? Was there any, I mean, I don't know if you could see that in these studies, but was there any of the hallmarks, the biomarkers like plaque and tangles?
No, so this is something we were not able to study, partly because we only did pre-mortem imaging using CT, and PET imaging is not available in the area of Bolivia where the participants were scanned. We also didn't have access to post-mortem samples. But what we did have is CT scans of the brain and a neurological exam and cognitive exam that allowed our collaborators on the clinical team to gauge the extent to which the patients, the subjects were cognitively impaired or had dementia.
It's really, really fascinating. I wanted to ask too, because I had heard in the past of a tribe in Africa who are very predominantly APOE, 4 dominant, meaning they possess, many of them possess the Alzheimer's gene. And was there any genetic testing involved to understand whether or not some of the Tsimané people also were carriers of APOE4?
Yes. So as you know, the APOE allele, E3, E4, and E2, these alleles are important in determining the risk for Alzheimer's disease because in industrialized societies, the E4 allele is usually reflecting a risk for an increased risk for Alzheimer's disease. Now, in the Tsimané, we did have genetic sequencing data, and the prevalence of E3 is not that different from that seen in countries like the United States. However, again, given the predominance of E4 that we did have, the number of cases of dementia is extremely small. And so this goes back to a very interesting set of observations that and hypothesis that's been put forward that in the evolutionary past, the E4 allele was actually protective against dementia in the context of an environment with high levels of exercise and healthy eating habits. However, as we transitioned from this environment to an industrialized environment, the theory goes, the E4 allele became a risk factor because when it interacts with environment where you have a lot of sedentary lifestyles and poor diet, the E4 allele becomes a risk factor. And so in the Tsimané, even though we see rates of E4 that are not that different from the US and Europe, we do have very low rates of dementia, which seems to confirm or at least add to evidence in favor of this hypothesis that E4 was originally protective against dementia, or at least not as much of a risk factor as it is today in industrialized countries.
That's really interesting. Yes, that's really, really interesting. What about in terms of pollution, polluted environments? I always worry about this too, because I spent a lot of my time in Hong Kong, which, didn't have the best air for long periods of time. Do we know, like you talked about a comparison of two different communities, the Tsimané and the
Mosetén.
Sorry?
Mosetén.
Mosetén, yeah. So you said the Mosetén were more exposed to industrialization, right, than the Tsimané. I'm not sure it was like living in, New York City or something, but what were the differences between those two studies? I mean, did you see a great impact in terms of the brains that you were seeing?
So yes, so the Mosetén are somewhat more exposed to industrial lifestyles in the sense that they interact somewhat more with the market economy of Bolivia. They purchase some of the pre-processed foods that are available on this market, and they also have lower levels of physical exercise. And when we did this study and other studies we've been involved in, we did look at a comparison of the Tsimané and Mosetén in terms of brain size. And what we did find, not only relative to brain size, but also to other health parameters, is that this more sedentary lifestyle, even though still less sedentary than that in the United States, is actually associated with faster rate of brain volume decrease and with other cardiovascular parameters that are reflective of cardiovascular disease risk. And so the Mosetén may be exposed to also partly more pollution. We're still looking at the pollution data, but still there is a lot of more interaction with the industrialized market and the market economy of Bolivia. And so you have this population that's somewhere in the middle between a group like the Tsimané, who do not have high rates of sedentarism, who have a very healthy diet, and what we have in the United States.
So when you were talking about exercise, how much exercise does the Tsimané people get?
Well, on average, it's about 18 to 20,000 steps a day. But there are some in this population who actually get more, who get quite a bit more, up to 23, 25, 27,000 steps a day. And it's usually not high intensity exercise. It's usually just moving around during the day, doing chores, hunting for animals, and doing the activities of daily living. So it's usually constant movement throughout the day.
Is community a big part? I'm assuming it is. I mean, in terms of living in community, families living together, what is the design of and structure of the social setting and family there?
Well, they live in villages that are clustered in a geographic area in central Bolivia, in the lowlands of the country, within the Amazon basin. The villages are spread throughout the natural environment, and they range in size. They're usually small to medium-sized communities, nothing like the size of medium-sized cities in the United States, but still there's a range of community sizes, and within each community, usually the role of men is to search for food in the forest, for game, and women usually stay in the village and take care of the children and cook for their young and for the men. So
when you look at what we know so far from this specific study, what are your conclusions as a scientist? Like what are the key takeaways?
Well, an important key takeaway is that there is what we called in the paper an embarrassment of riches, in the sense that the brain functions optimally when there is an optimal level of food intake and exercise. If there is too little exercise, if we do too little exercise and we do not eat enough food, our brain volumes will be relatively smaller. And that's actually what's been seen in the US and Europe when researchers studied eating disorders. In persons with eating disorders, brain size is smaller. On the other hand, if there is too much sedentarism and there's too much food intake, we also see an atrophy of the brain and poorer health parameters. And that's what's been seen in the United States relative to example, obesity. So there is a sweet spot in between those two extremes where the brain thrives. And that's exactly what we saw in the study, where we saw optimal levels of brain volume and cholesterol at somewhat higher levels of cholesterol than the BMI, the average BMI in the United States. And so we saw an optimal level of brain volume at BMIs a bit over 25, although the comparison is a bit fraught by the fact that the Tsimané are on average more muscular due to their lifestyle than people in the United States. So the conclusion of this is that with proper exercise and lifestyle and diet, we have a natural sweet spot for brain health that's in between the two extremes I mentioned, and that allows the brains to thrive in the environment we have.
Are you thinking, I mean, are there plans to carry this study out further from here?
Absolutely. So this is a study for which the National Institutes of Health has awarded us several grants. One of them was just renewed last year for another 5 years. So we plan to continue this research and hopefully also acquire a second round of imaging so that we can compare how the brain has changed in time. Our previous study was on cross-sectional data. Now we plan to have a longitudinal study. And then we also applied for funding that we hope to receive soon to study the brain, to focus on the brain component and to study a vascular calcification, neurovascular calcification in particular, as a biomarker that relates cardiovascular health to brain health.
Wow. I can't wait to get the results of those. And I should point out the age of the study was what you were studying, which age group?
So the age groups we studied were for participants between the ages 40 and 94.
And the lifespan for the Tsimané is what? Average lifespan?
The lifespan of the Tsimané is changing. Typically, it's they die typically in their 50s currently, and the usual cause of death is from respiratory infections, and that's something that should also be mentioned. They have a very high incidence of respiratory infections, high rates of tuberculosis, and also intestinal parasites in the environment where they live. And usually both high rates of infection and parasites are associated with higher inflammation levels and smaller brain volumes. But because they have such a strong protective effect from their lifestyle and from their diet, potentially even from their genetics, we're still looking at the genetics, because they have so much protection from that, we do not see the deleterious effects of chronic inflammation that usually people get when they have high levels of respiratory infections or chronic parasite infection.
That is really, really interesting. Thank you so much, Dr. Andrei Irimia, for joining us again. And, by all means, keep us updated on this study. I find it fascinating to look at, and really just so much more evidence that lifestyle does play a key role in really keeping our brains healthy. So thank you so much for joining us.
And thank you very much. It's been a pleasure, and I look forward to reporting on other studies in the future.
Great. And if you want to see more of this interview, if you missed some of it, or you want to know more of upcoming topics, please sign up for our newsletters on beingpatient.com. And also send us an email at info@beingpatient.com to let us know what topics you want to know more about. These talks are meant for our audience, for our community. They're totally free, just to keep people informed of the latest research. Thanks everyone for watching, and see you next time.